Thank you for standing by and welcome to the PainChek Investor Webinar and Q&A following the company's quarterly update. Please note the presentation being used today is being lodged with the ASX. All participants are in a listen-only mode. There will be a presentation lasting for approximately 25 minutes, followed by Q&A. If you do have a question you'd like to submit, please feel free to type it in using the Q&A function within Zoom. Please note the session is being recorded today. On behalf of PainChek, we have the CEO and Managing Director, Philip Daffis. I'll hand it over to Philip. Please go ahead.
Thank you, Matt, and welcome everyone, and thank you for your time today. I'm pleased to present the quarter results for PainChek. The company, I'm pleased to say, has had its fifth consecutive quarter of double-digit growth in terms of licenses. We now achieved 85,000 licenses across 1,400 aged care facilities and across 3 continents. It's truly a global business. Moreover, PainChek is within now touching distance of the 100,000 contracted licenses milestone that would cover the core company operating costs, that's excluding R&D and corporate overhead. And we have in place today global partnerships and a pipeline of business opportunities that exceeds 1.5 million bed licenses. That's 15 times the initial 100,000 target group, license group. So this provides the basis for rapid, continued growth and for hitting those future profits. So pain assessment, as we know, everyone knows, is very difficult. And our mission is to give a voice to those people who cannot reliably verbalize their pain. On one extreme, we have adults such as those living with dementia and cognitive impairment who've lost their ability to communicate effectively. On the other side, we've got pre-verbal children who have not built those communication skills as yet. We have developed 2 apps, medically rated, regulatory approved, using AI technology and smart automation for both these vulnerable groups. Today we focus very heavily on the adult, but I'll also, towards the end of the presentation, update you on our progress with the infant. So PainChek remains the only validated and regulatory cleared medical device for those who cannot verbalize their pain. The technology is rapidly replacing all the old paper-based systems used previously, including the Abbey Pain Scale in Australia and UK and many markets, and we're being supported by people and specialists such as Dr. Abbey herself, who's now on our advisory board. Our success is really driven by improving the quality of life and clinical outcomes for those vulnerable people in a cost-effective manner. These outcomes are now being not just case studied, but being published, as you will see in the presentation, in peer-reviewed global publications showing the clear benefits that PainChek's bringing to these people. So a quick summary on the app itself. It's a multi-dimensional app. It assesses 6 items of the pain scale and provides a pain severity and pain number as part of that process. The PainChek app is simple and rapid to use by any trained carer. Really 2 or 3 steps in the process. First step, the PainChek app uses the AI inside the device and the mobile camera in a smart device to conduct a 3-second scan of a person's face to analyze and document the presence or absence of 9 facial features that are indicative of pain. These include things like brow lowering, nose wrinkling, parting lips, eyes closing. We then guide the carer to observe and document additional pain indicators, such as the voice, such as movements, behaviors, and activities, for a series of digital guided checklists within PainChek. The device then automatically provides a pain assessment score, which can range from 1 to 42, and it assigns a pain intensity level, which could be no pain, mild, moderate, or severe. As you will see, in addition to this, PainChek provides the carer with a unique personalized profile that allows a person to identify their pain, personalized pain management, and personalized pain assessment. And this is another unique feature of the product, which I will explain in more detail through this presentation. Now, with all the talk of AI and the issues of replacing people at work, this is a perfect example, I believe, of how AI, artificial intelligence, combines with human intelligence to provide better care. We're not replacing people, we're enhancing their ability to manage their patients or their residents' care. So in terms of valuing the markets, we know we're focusing on four large global markets. The first one of aged care, which we've been in for a while, and we're very well penetrated now. It's 6 million beds in what I call the Western sort of world, and 300 million potential ARR. So we've done a really good job, I think, of showing how we really could do value in those markets. We started in the home care market, which is 10 times, we believe, is the size of that in comparison as governments move towards care in the home care and retirement villages as a lower cost method compared to hospitals and aged care. And we've already started selling into that in Australia. Infant market, we know, is far larger than the actual aged care market. Again, there's 400 million pre-verbal children, 150 million born each year to first-time parents. And we estimate we get 1% penetration of that 400 million market. It will be as large as, just 1% of the infant market is as large as the whole of the global aged care market. And finally, the hospital segment is something we're focusing on, and we've already communicated that we've started our work at Edinburgh Royal Infirmary as our first hospital client as part of our intersystems relationship. So established in aged care, but already moving into those three other markets, which are all significantly larger. So let's look at the results for the quarter. So 85,000 contracted beds now, reflecting a 3.9 million ARR when all fully implemented, and it's still maintaining a 70 to 85% gross margin. The PainChek model or business model is a subscription SaaS business model. It's rapidly scalable. It builds long-term retention with our clients, and the model has now been proven for more than 5 years. The company's exceeding standard SaaS business industry performance by achieving a 90% plus quarterly retention rate. We've been doing that for the last year. Of the 85,000 beds, around 60,000 are currently implemented. There's always a lag time between signing a contract and implementing, and we've signed up a lot of contracts in the last 6 to 9 months. But we do have the team and the training partners in place to fully implement the remainder as rapidly as possible so we can recognize and collect the full revenues. Very important, as I mentioned before, that we are in touching distance now of achieving the 4.8 million ARR, around 100,000 beds, which would effectively cover our core operating costs, excluding R&D, corporate and expansion costs. We are in touching distance of that massive first milestone. We look at a bit more detail. This highlights the split between the Australia business or ANZ business and the UK business. And as you can see now, we're starting to get faster growth in the UK, 150%, 153% growth in the year, albeit from a smaller base and a significantly larger market. This is part of the value of being a global business, because we have different markets at different stages of maturity and different size opportunities and different growth levels. So as we go into more and more markets, this gives us the basis for rapid market growth. So we believe the sales curve you're seeing here across Australia and New Zealand will continue to accelerate as we further progress into Canada. We've already got 500 beds there. And as we go into mainland Europe and the US, both targeted for 2024. In terms of assessments, we think there are 2 key clinical things to look at in terms of take-up and utility. One is actually the use of the product, and the second one is the number of carers trained. And we still see a significant growth every quarter. We now have more than 4.1 million pain assessments documented on the platform. That is the largest pain database in the world. It's significant growth. And we've also now got more than 13,000 carers trained. Now, once a carer is trained on the system, that's a major milestone in terms of driving adoption of the product. So in addition to this, PainChek is a digital technology. We can do a lot of our work in terms of training and support remotely, which means we can fast track the process of implementation and optimizing costs for both parties. So let's look a bit more detail into some of the markets. In Australia, we've actually now got 57,000 contracted beds. We've got more than 30% market share, and we have a very strong focus on the larger aged care groups. And these aged care groups are consolidating through purchase of smaller aged care facilities, and we're also fully digitalizing their information system. And being the only digital pain assessment tool, PainChek fits in perfectly. These same large clients listed here also have the major share in home care packages, and so we're working with them to continue the expansion of use of PainChek into their home care services. One of the key clients this year, this quarter, should I say, was Bolton Clark. We already had 3,500 of their beds through their company Ality. Just before Christmas, Bolton Clark extended that agreement across all of their 8,000 beds for the Bolton Clark Group. That will be rolled out in March to April this year, post the implementation of their new CMS system. We've also got a strong pipeline of clients and partnerships to fully access the 200,000 Australian market aged care beds. As I mentioned before, we're expanding into home care and retirement living through those existing partners. If I then look at the UK, as you can see, the UK is rapidly following the Australia-New Zealand progress. The market there is worth more than double, about 500,000 beds. In the UK, the sales grew by 29% in the quarter to 25,000 beds, which is around 5% of the market. So there's a lot of growth opportunity there. In the last quarter, 24 new agreements, 6,700 beds, and 142 new homes come on board. The largest of those was a group called WeCare, 1,400 beds across their whole group. We have a number of pilots in place with large providers. We are continuing our work with the Scottish Care Inspectorate that could take a rollout to over 38,000 beds across their 1,000 homes in Scotland. And as I said before, we've started into the Royal Edinburgh Hospital, Edinburgh Royal Infirmary Hospital in Scotland with the PainChek app for use by their pain team across the whole hospital. So these are all great examples of how we're expanding in the UK and into new segments of the market. Importantly, we talk about having 85,000 beds across 4 markets and touching distance to 100,000 bed milestone, but our pipeline and our partners listed here give us access to more than 1.5 million beds across these 4 markets. How are they helping? Well, first of all, they integrate, which makes it very, very easy to use PainChek and very sticky in the medication management systems. And they're starting to resell. We've now got an agreement with a group called Nourish in the UK, who cover 100,000 beds themselves, and they've taken up a reseller agreement to fast-track PainChek into their groups as well. This all means easier access to clients, means faster sales implementation, and our goal is to rapidly surpass the 100,000 beds and drive towards that profitability number. Just an example of what the value we're bringing, and this is reported previously, but I want to come back to this again because the Orchard Care work, which was stunning work showing how we're improving care and optimizing medication management, has now been published in the Frontiers of Psychiatry publication. It's a peer-reviewed journal. There's a link to it there on this slide, and we will encourage everybody to have a read of the actual publication. Because it's actually stunning work, and PainChek's part of the process. We're not the solution on its own. We're part of the process of how using a better pain assessment tool has changed their care. This slide I'm showing you now was a slide I showed last time in terms of looking at the quality of life and medication improvements. But as you can see the quote from Cheryl at the bottom there, they've reduced all PRNs, predominantly antipsychotics. They've reduced pain relief by 48% of the year. They've reduced average pain scores through better pain assessment and pain management. And in addition, they're saving about 6 to 10 hours per month by using the PainChek system. So this is a perfect scenario in a healthcare environment: improved care, reduced costs. That's the perfect solution, and that's what we're delivering. We talk about the US. US is obviously clearly important for us, a major target this year to get FDA clearance. And as I mentioned before, we have 3 partnerships in place with Point Click Care, Ethos Labs, and Systems to take us into the market. Some updates on this. So the study itself in the US, we've already now completed 4 out of the 5 sites in Iowa, which is where the main work is being conducted. And we're just starting this week. In fact, my colleague, Preshnik Hoti, is in the US right now doing the training at the aged care facility in New York. There were some delays because of COVID just before Christmas, but now they're back on track. And that studies the New York element of the study, which is looking at the different facial populations of the United States, is about to start early next month. We still see the completion of the study by the end of Q1 and then submitting to FDA soon afterwards. In terms of access in the market, two of my colleagues were attending the PointClick February global conference, which mainly focused on US clients, but it's a global conference as part of our pre-launch activities. And we've been meeting there with senior executives representing up to 50% of the US aged care market. So we're already starting to make traction into the US, having already done some work already in Canada. And then the June period, we work with Royal Edinburgh Hospital to present the outcomes of their work at the Intersystems Conference in Maryland in June, and that will be to a global hospital client group organised by Intersystems in the United States. So these are two examples of how we're preparing the market to get ready for that US FDA clearance. So in summary, I thought this was a nice slide to sort of summarize that we know we are a global business. We've talked about Australia and New Zealand and our progress there. We've talked about the UK. In fact, we've got 25,000 beds now licensed. And we've talked about the United States and our entry. Canada, we've already got regulatory clearance and we've got initial sales. We're establishing some footholds in Europe this year. I've started that process late last year when I was in the UK. And we're in the process of looking at the regulatory clearance for Japan, and that will probably follow directly after the US clearance because the Japanese do like FDA data. Also point out here, we have patents in US, UK, Europe, and Japan, the largest markets in the world for healthcare, which means that our future is very well secured. So finally, I want to sort of, before I go into the infant, I want to talk a little bit about the added value PainChek is delivering in the aged care facility and how it could impact all people and how PainChek would become a global pain assessment tool for the global population. And it's all based upon our analytics. We've got the largest pain database in the world. We've been analysing pain trends to build phenotypes, or we call observational traits of people's pain profiles, so we can help carers to provide better pain care for everyone. I'm going to use David and John. These are dummy people, they're not real names, and to explain how this sort of works in aged care and also how it could go further. So this is a scenario that we often see in aged care. Again, this is dummy data, it's not real data. But imagine there's two people in an aged care facility, John and David, and they're being assessed for pain. And one thing about PainChek, it can help the carer provide an accurate pain assessment and pain intensity score. So John on the left is a 77-year-old advanced with Alzheimer's dementia, osteoarthritis, unable to communicate pain, and the carers suspect he's got pain, but they're not sure. On the other hand, David is a 70-year-old with advanced dementia. He's recently had an injury, he's unable to communicate, and the carers again suspect pain, but not sure. PainChek is used, and in both cases, they get a pain score of 14 for the same scores, which equates to a moderate pain score. So now the carer is confident they can treat the patient. But if we start to look at the 6 domains of PainChek, the face, the voice, movement, behavior, activity, and the body, and start to dig a bit deeper, we can see there's differences between their pain severity and their pain scores or pain profiles. John, on one hand, he has moderate pain. According to his pain profile, he's introverted. He's got fear of touch and has prolonged resting. And in comparison, we look at David. He has a pain score of 14 again, exactly the same pain score. But if you look at his profile, he's verbally aggressive, he's abusive, he's resisting care, and has an altered sleep cycle, probably not sleeping much during the night. Now, having that information together means you can actually manage their pain differently. And the point is, John and David have been affected by pain significantly differently, and their experience of pain, therefore, is different. So David's pain, as an example, is obviously imposed a lot higher care burden as well. So this gives a nurse and a carer greater insights as how to manage their pain, another reason why PainChek is making a significant difference. I saw this presentation when I was in the UK to a dementia conference, and the whole room was silent. They said, this is exactly what we need to manage care better, and that's what all care and these people are doing. So I want to share with you something about what I call the past, the present, the shape of things to come. And what does this mean going forward? So PainChek started a journey as effectively a non-verbal dementia pain assessment tool. We moved in 2020 to become a universal tool that can be used for all people in aged care, regardless of their ability to communicate or not communicate. And that's been proven because that's how all our contracts work today. We're now taking all the data, the 4 million pain assessments, using 2 million first, and we're now profiling individual pain experience, because the pain experience is how pain is impacting the person and how it impacts people differently. So it is the impact of pain that moves us towards pain profiling. So it's not the score, it's not the intensity, but it's the personalization. And this massively increases the value add of PainChek. This is how we work today in aged care, but also can be a real differentiator. And I believe this is something that we can move into personalizing pain management, not just for people in care, but for people everywhere. Because we all know that a 1 to 10 pain score today is not enough when you're trying to explain pain. You need profiling, and we believe you need personalization. And that is what PainChek is providing and moving to the global population. Finally, talk about the infant product. We've given us our first venture into the global direct-to-consumer market. We've completed a second phase of consumer market research with parents. The feedback confirmed the following. Firstly, positive feedback on the real-world performance of the PainChek Infant Adaptive Video System, which was developed to help address the situations where head movement is rapid with a child, and we still want to be able to do the facial pain assessments. And that's often linked to a crying baby. So that's positive. The second one is we've developed this vocalization. We call it the cry of pain or no pain vocalization discrimination feature. This was tested with the parents, and they saw this as a highly desirable new feature to help them assess and manage their infant's pain. This is just using the microphone, a smart device, or on a baby monitor to pick up pain cries and differentiate whether that's a cry of pain or no pain. The feedback also gave us some really good insights in terms of the direct-to-consumer marketing and the influencer channels that the parents like to see, and the preferred baby monitors and infant apps that would fit in nicely with them. So we're now ready to go to the market, commence marketing strategy in Australia with the face-only infant app first, because that's the one that's regulated and validated. We'll be targeting parents 1 year of age. And once we've got through the Australian process, we'll look to extend overseas. The vocalization feature will come later. There's a lot more work to do on it. It's working really well, a lot more work to do on it, but it's also an opportunity to sell that to multiple groups as a unique standalone feature. So just a graphic to show how the whole system works. If the parent cry, here's a cry. We've got 2 solutions now. We've got the facial assessment technology to actually measure and monitor ongoing pain. And now we've also built the infant vocalization technology to detect a cry of pain or no pain. And that could be used as an app, like a Shazam type app, or could be used within a baby monitor. Either one gives the parents or caregiver ability to treat and intervene accordingly, and it can be used by the whole family. So our goal is making pain audible and visible. So upcoming catalysts, so we'll continue to grow and expand our commercial beds in aged care, leveraging the positive outcomes from Australia, New Zealand and the UK markets. We will do this again with our partners, our global partners, more than 20 states, covering 1.5 million beds, a recognition of our unique technology. We will continue with the FDA clearance work. We'll submit, complete the study by the end of this quarter, and then submit rapidly afterwards. And we'll expand our presence within the systems internationally for the hospital sector. We will start now in Q2 with our direct carer program with Infant App to access the large infant home care market, and that will position us really truly as the unique pain assessment technology for both adults and infants. This is a corporate summary. Thank you to our shareholders for your ongoing support. We're now generating real cash to fund the future business, and we're demonstrating a strong top-line growth compared to previous years. We have a $1 million R&D rebate coming in soon, which will help the cash position, and board and management still remain around 10% of the whole company. Team is consistent. It's a great team work around the globe, and the team has been with us now for a number of years. And so is the board. We welcomed Cynthia Payne into our team last year. So I'll hold it there and pose the questions.
Thank you very much, Philip. As you've mentioned, we'll move on to the Q&A session. The questions are based on some sent through via email and others via Zoom. So if you have a question you'd like to submit, please feel free to type it in on your screen. The first question I have is, when do you predict PainChek will be making a profit from the apps and not have to continue with capital raising?
Oh, it's a good question. Look, to be frank, as I said earlier, we know that I could stop expansion. I could not get into the US. I could stop expansion into multiple markets to get the infant product. We could actually just shut everything down tomorrow and just with the current licenses we have in Australia and New Zealand and focus those markets, we could be profitable. That's not a problem. But that's not our goal. Our goal, I worked for Cochlear for many years. I've worked for Pfizer. I've worked for Roche. Any global business, anybody who wants to become a true major company needs to go global. And we've got the basis to do that. We've got the plan to do it. And, we are generating more and more cash to enable that. But, the goal is not to make it profitable short term. Our goal is to get us to a state where we are a significantly large business and highly profitable.
Thank you. The next question is, have any large health companies made inquiries into taking over PainChek and its patents as a valuable asset?
We've had lots of contacts with various companies. We know a lot of companies, larger corporates do like what we're doing. We're working with them mostly as partners because that's really the way to operate. We've named a number of the partners already. We've made into Systems, we've made Ethos Labs, Point Click Care, with all the other people, and there are others we're talking to, which I can't disclose. But at the end of the day, our goal is to establish this as a standalone business, and I'm sure we'll have lots of licensing and lots of other opportunities with those companies to actually expand and rapidly grow our sales and profits.
Thank you. The next question is, once the FDA trial is completed, are you expecting the FDA to take the full 150 days to make a decision?
That we don't know. It's a good question. Sometimes they go faster, sometimes they take the full 150 days. Ours is not a complicated product. So I think they typically take 150 days for the therapeutics and the drugs that are more complex. Ours is a pretty simple product. It's a small study. So I'm really hoping they will take less than that. But as they say, they've got the right to take up to 150 days should they want to. But we've got a good relationship with them. We're in close contact with them. And I'm hoping they come back to us a lot faster.
And then on the same note, if the FDA approval is rejected, is there a mitigation strategy for the company?
Well, I think typically we do get access to some of our data as we're collecting the data. So we know exactly what the FDA are looking for, and we're looking and therefore we can actually see, whether we're sort of aligned to what they're looking for. So I don't think, our goal is to avoid that situation. And we also avoid that situation by doing 2 or 3 different pre-sub supplements to make sure we and the FDA were totally aligned in terms of what they're looking for as outcomes data to validate the product. So I think we've mitigated it up front. And yes, there may be 1 or 2 minor things they come back with, but I don't see anything significant. It would be basically refinement of X or Y that may take a matter of months to actually get through. But I'm touched wood, I'm hoping we get through first pass.
Thank you. The next question is there any update on the infant minor surgery pain study results?
Oh, there's a number of studies going on with the infant product in various locations. Look, as soon as we have the data, we'll submit it, but obviously not at this stage.
The next question is it a shortage of sales and training staff that leads to slow uptake, or is it conservatism within the aged care sector?
Can you repeat the question, Matt?
Is it a shortage of sales and training staff that leads to slow uptake, or is it conservatism within the care sector?
Look, I don't think it's been slow uptake. I think we've actually had significant uptake. 5 consecutive quarters of double-digit growth in a company of 27, 28 people, I think is really significant. But there is, there is obviously a process. There's a selling process like any other product. There's a justification. There's a business case that has to be put forward. All those elements are part of the process. But if you look at our spread of our sales, all the larger aged care facilities are going down this route. They're consolidating, their digitalization, their technologies, and pain is one of the key aspects. And we are the only technology available. In fact, I see more and more opportunities and growth opportunities in our current markets than I've ever seen, purely because the realization is that everybody needs PainChek, especially in the aged care facilities, and growing now into home care and growing now into hospitals.
Thank you, Philip. The next question is, what is your total headcount and how many of these are sales staff?
With about 27 headcount, probably 4 or 5 outright sales, but we have probably about 5 or 6 across Australia, New Zealand, and the UK. 5 or 6 are in account management, which is really sort of customer success, which is follow-up to sales and client retention. And then we have a number of people doing clinical studies, clinical training, education, and they go as part of the implementation program. Probably similar sort of number, 5 or 6, and then we have about 2 or 3 people doing out-and-out research. But I would say we do have a number of contractors in the AI space and the digital app space around the world, not just in Australia, really around the world, who work with us for different elements of what we're trying to do. And that's what our tech teams, we've got about 5 or 6 in tech. And what they do is they work with those guys around the world. So 27, 28 people, that sort of number, and equally spread around. But I would say one thing, if you look upon it, we've done 30% of the aged care market in Australia with effectively 2 people doing selling. It's incredible.
Thanks, Philip. Just taking a step back to basics, someone's asked, can you please discuss how reliable and easy to use the PainChek technology is and the analytics that come with it?
Very simple. It's everyone. The great thing is that everybody now knows facial recognition on apps, because we go through it with passports, and we go through passport control, we go through getting to our bank account on our phone. So it works exactly the same that way in terms of doing the analytics, facial analytics, except that it takes 3 seconds, analyzes the face and documents the facial pain scores or the facial indicators of pain. And then it's a 5-step process. So there are 5 other indicators, and we guide the carer through those things. So we give them a checklist to observe. So it's educational. We say, look for these things. If you see these things, tag it, and move to the next one. Look at the voice, look at the movement, look at the behaviors. It takes about 2 to 3 minutes in total time, but it gives you an accurate pain score. And then again, as I said before, and a pain profile to consider how to best manage the care for that person. And the pain profile, I can't help but say, that is becoming more and more important. And there's no one that does that like PainChek. We're unique in the facial assessment. We're unique in the pain profile we give. There's nothing like that available anywhere.
And then a follow-up from the same person was just, does this have an application in the disability sector?
Yes, 100%. We've already got 3 disability contracts in Australia. We are working with the telephone group in Western Australia. We've got a government grant in Western Australia to actually build a kids version of disabilities, PainChek for kids with disabilities. And that was a funding come from the telephone charity. And we're working with the University of Western Australia to produce that version of the product. And in fact, they're collecting the data for us, and we'll be doing all the data science work and all the analytics and all the profiling for the app. And that's going to take a year or 2, but we're already using the current adult version for disabilities, and we're developing a special one for kids with disabilities, which will be, I think, be phenomenal.
Thank you. The next question I have is PainChek useful for those residents with the facial freezing or masking seen in those suffering from Parkinson's?
That's a good question. We actually need half the face. When we're doing our assessment, if we can get 1/2 of the face, then that's fine. But if you do have, clear freezing or other indicators that impact facial expressions, then yes, that can be a problem. But we also have a manual mode in that situation. So we also train carers for those unique situations, I would say, to how to use the manual mode to actually pick up and document manually those facial stores when the facial observation part can't work as effectively as it does with a standard face as such.
Thank you. The next question is, are you able to give context to the over 2 million assessments in the last year? This appears to be huge growth. What is driving that uptick?
Utility. We train people, they like it, they see the value. It's utility. In fact, our account managers monitor every single client we have to see the utility. And we also have things in our system that says if you have a pain score, let's say you have a pain score, then the system it automatically alerts people to come back and reassess. Yeah, so we're not static, we're actually active in the way we do things. So we pick up pain scores, we actually alert carers to reassess, we alert them to assess at rest and also post movements, because often people can be sitting comfortably and not be in pain. So we say, fine, do the assessments at rest, but then do it again after movement. Move the person as soon as you can, and then reassess, and then look at the difference, because then you start to see where pain's more expressive after movement. So there's a whole science behind this area, and a big shout out to our trainers and our account managers who do this, because we don't just provide an app, we provide a real education on pain management and pain assessment. I think there's no other company in the world that does what we do.
Thank you. Just one or two more questions. Can the infant vocalization be adopted for the adult app using voice changes rather than cry?
Yeah, look, not at this stage. I mean, the unique thing about the infant is, of course, infants don't typically have chronic, long-term chronic or a pain, which unfortunately adults do have. So we do have a vocalization feature on our adult app that's more observational. So we guide carers to look at different sounds and observe them, but also to record the sounds so they can compare the sounds when they come back later to see the difference. The unique thing about the kids is that when we developed our facial version of the kids app, we also collect all the sounds of the children or the infants crying when they were going through their painful procedures. So we then had the base data and the ground truth of what is a cry of pain against what is a cry of no pain. And that's how we've actually been able to build that. But look, we want to automate as much as possible going forwards. And of course, the better we can do for adults as well, we'll incorporate. But vice versa, we will eventually bring in for professional versions more of that multimodal thing for kids as well in the future. So we want to give pain profiling for kids as well in the future, as well as that ability to assess pain and document pain, both through the face and through voice.
Thanks, Philip. And the final question I have is, what return metrics do you consider when deciding on whether to allocate capital to new regions or markets?
Well, we had a board session. We review regularly, the priorities, which markets to go into, which markets not to go into. Just for example, Japan. This week we made a strategic decision. We're doing US first, and then we'll put the effort into Japan afterwards, because the US data is helpful with the regulatory clearance to Japan, and also because we can't do everything well. You've got to have a focus. So when we started this journey, we said, let's get Australia working. New Zealand was a natural extension. That's happened. UK was because of the Abbey pain scale link. There was a very strong link to that. It was a natural market to move into. And, the UK and of course, Australia have very similar care systems. And that led to Canada. Canadians found us actually, and they like what we're doing. They had a similar. So it's what's the most effective and efficient route to get to market. We haven't spent much money building this business. We've spent very little money, but we've actually established it as a unique product. And then of course, after Canada, then the US is always a market to aim for. And then this year's the goal is US, and I will spend more time in Europe this year. And I've already got some contacts now in France, Germany, Switzerland, as we look to actually enter those those major European markets.
Thanks, Philip. I'll hand it back to you just to provide a closing comment.
Well, look, just want to say thank you to everyone. Thank you for support. I do believe if you go through the Word document that we've submitted today as part of the quarterly updates, it's very detailed. We really give you so much information. We are working on all sides and we are prioritizing effectively. I think the take-up of the business, the take-up of the sales and the utility of the product speaks for itself. We are unique. We're a global market opportunity. And I just want to touch again on that issue about the whole issue about pain profiling. I have so many friends of mine, you know, at my sort of age, you say, Philip, can we not have a PainChek for all of us that we can, 1 to 10 isn't enough. I'm fed up of going to the doctor. He says to me, how much pain you in, give rated 1 to 10. I want something more. I believe our pain profiling that we're using with people with dementia in care, it can translate really not well into the general global population. And that's one of our strategic goals we want to focus on going forwards, because then it means that everybody can have a better pain profile and everybody can get better pain care. And that's good for the global population.
Thanks, Philip, and thanks to everyone for joining. We'll leave it at that today and look forward to updating you next time.
Thank you, everyone.